Hello everyone, welcome to Acupuncture Matters. Today we will talk about scalp acupuncture for dysphagia. This is brought to you by Lamp AccuWellness Foundation Inc., the benchmark of quality acupuncture education. Dysphagia is the medical term for the symptom of difficulty in swallowing. The signs and symptoms of dysphagia include difficulty controlling food in the mouth, inability to control food or saliva in the mouth, difficulty initiating a swallow, coughing, choking, frequent pneumonia, unexplained weight loss, gurgly or wet voice after swallowing, nasal regurgitation, and swallowing difficulty. When asked where the food is getting stuck, patients will often point to the cervical region. The actual site of obstruction is always at or below the level at which patients perceive the obstruction. The most common symptom of esophageal dysphagia is the inability to swallow solid food, which the patient often describes as becoming stuck or held up before it either passes into the stomach or is regurgitated. Some people present with silent aspiration and do not cough or show outward signs of aspiration. When the airway is unprotected and foreign material is aspirated into the lungs, the person is at risk for development of pulmonary infection and aspiration pneumonia. A swallowing disorder can occur in people of all age groups, but it is more likely in the elderly, patients who have had strokes, and in patients who are admitted to acute care hospitals or chronic care facilities. Dysphagia is classified into two major types: oropharyngeal dysphagia and esophageal dysphagia. Oropharyngeal dysphagia is often caused by stroke, multiple sclerosis, myasthenia gravis, Parkinson's disease, amyotrophic lateral sclerosis, and Bell's palsy. Esophageal dysphagia can be subdivided into mechanical and functional causes. Functional causes include achalasia, myasthenia gravis, and bulbar or pseudobulbar palsy. Mechanical causes usually comprise peptic esophagitis, carcinoma of the esophagus or gastric cardia, candida esophagitis, and pharyngeal pouch. Medicines can help some people, while others may need surgery. Treatment with a speech-language pathologist can help. Patients may find it helpful to change their diet or hold their heads or necks in a certain way when they eat. In very serious cases, patients may need feeding tubes. Case history. We have a 62-year-old male in a wheelchair brought to our clinic. His wife gave a brief medical history because of his aphasia. 1 month before, Fred had severe headache, slurred speech, and the right side of his body became paralyzed. A local hospital diagnosed stroke caused by cerebral hemorrhage in his left hemisphere. He initially was totally paralyzed on the right side and had lost his speech. He had been receiving physical therapy and speech therapy since he was admitted to the hospital. Although his aphasia gradually improved, his speech was not clear. His voice was low, and it was very difficult to understand him. He had severe dysphagia and could not swallow any food or water at all, which was his primary complaint. He felt depressed, irritable, angry, and severely fatigued. A nasogastric tube was inserted to provide non-oral feeding. Examination showed he was unable to move his right leg and foot at all, with muscular tone at 0 out of 5. He could move his right arm slightly, with muscular tone at 2 out of 5. He could not elevate the hyoid bone, indicating a probable swallow reflex problem. Maximum phonation duration of 7 seconds indicated reduced breath support, likely resulting from vocal cord paralysis. He had a weak cough and diminished throat clearing ability. His aphasia, dysphagia, and paralysis on the right side had shown no further improvement for the past 2 weeks. A hospital physician recommended that the patient try acupuncture treatment. Upon examination, he looked very tired and depressed. His tongue was red with a dry, thick yellow coating, and his pulses were wiry and slippery. TCM diagnosis showed liver qi stagnation, spleen qi deficiency, blood stasis in the channels, and liver gallbladder damp heat. Scalp acupuncture treatment, area selection. Primary area, upper 1/5, middle 2/5, and lower 2/5 motor area. Secondary area, speech 1 area. Same as the lower 2/5 motor area. Neck point, a new extra point for dysphagia, located at 1 inch below gallbladder 20. Manipulation. The entire motor area should be needled and stimulated on the opposite side of the paralyzed limbs. Always put 1 needle in the ear point shunnman to help a depressed and angry patient relax and to reduce the sensitivity of needle insertion and stimulation of the scalp. Use the fewest number of needles possible in the scalp and rotate the needles at least 200 times per minute with the thumb and index finger for 2 to 3 minutes, twirling as gently as possible so that the depressed patient can tolerate the sensation, and repeating the stimulation every 10 minutes. Select the speech 1 area or some local points in the neck accordingly if the patient has aphasia or difficulty swallowing. Retain the needles in place for 30 to 45 minutes. The treatment is given 2 to 3 times per week, and a therapeutic course consists of 10 treatments. Communicate with the patient and any relatives often in order to gain their confidence, to encourage them, and reduce their fear and anxiety. During the treatment, some patients may experience sensations of heat, cold, tingling, numbness, heaviness, distension, or the sensation of water or electricity moving along their spine, legs, or arms. Telling the patient that those are normal and that people who experience some or all of these sensations usually respond and improve more quickly encourages them to come back for additional treatments. However, those who do not have such sensations could still have immediate positive results. The patient was very negative and showed no interest in treatment by scalp acupuncture at the initial visit. He was reluctant to do any active exercise when being instructed. Even after showing some improvement of his aphasia and the paralyzed arm and leg, he demonstrated no excitement and simply said, "I do not notice any difference about my throat and swallowing." At the second treatment, the patient presented with severe depression and no motivation. He did not like to perform speech, swallowing, and body exercises. His treatment strategy was modified to take care of depression. The ear points, heart, liver, and shunnman, along with the head area and the chest area on the scalp were needled. At the beginning of the third visit, the wife reported that the patient's mood and attitude were much better after the last treatment. He talked a little more and was easier to understand. To her surprise, he reminded her what time he had the acupuncture appointment that day. Since the patient's attitude was relatively more positive toward acupuncture therapy, we were able to perform stronger stimulation after inserting needles at the same locations as for the initial treatment. The patient was able to follow instructions, to practice his speech, and do oral and pharyngeal exercises. He started to smile after hearing himself count from 1 to 10 very clearly. He refused to try drinking a little bit of water to test his swallowing function and said he was afraid that it could induce severe coughing and choking and cause aspiration. With continued encouragement, the patient finally agreed to try. To his astonishment, he did not choke at all when he took a first sip of water. He drank more and finished a whole cup of water without a problem. The patient thrived on this program. He began to tolerate a soft, semi-solid diet, and the nasogastric feeding was gradually tapered down to overnight only as his oral intake improved. At this point, his weight increased and his stamina was markedly improved. The patient started to eat more solid food and add more kinds of food gradually. With every treatment, the patient showed dramatic improvements in speech, eating and drinking, and movement of his right arm, hand, leg, and foot. By the fifth treatment, the patient wanted to add more foods and soon could eat and drink anything like a normal person. The nasogastric tube was removed and he had no problem with talking or depression after his sixth treatment. His subsequent treatments were focused on his paralyzed arm and leg. He was treated by combined scalp acupuncture and body acupuncture. For body acupuncture, Li11, triple burner 5, and Li4 on the right upper limb, and stomach 36, bladder 60, and stomach 41 on the right lower limb were needled. Sometimes those points were stimulated with electrical acupuncture. The patient could move his right arm up and down more, and he was able to start walking to the clinic on his own. After the 16th treatment, he had gained more mobility and use of his right hand and gained more muscular strength in that hand. At the end of 20 treatments, his walking appeared almost normal. At his last visit, the patient said, "Thank you very much for giving me back my normal life." Scalp acupuncture offers great rehabilitation tools for dysphagia. Most patients with dysphagia showed some improvement after 3 treatments, and some of them appear better right away. However, to treat dysphagia, patients who have depression is very challenging because patients are not always willing to participate in the treatment. It requires very good needle technique as well as good communication skills. Sometimes it is necessary to treat the depression first and then address the difficulty in swallowing. Compared to other patients, in general, depressed patients should receive fewer needles, milder stimulation, and a shorter time of needle retention. Whether you are treating a child or adult with depression, it is important to observe the response and reaction while inserting, stimulating, or withdrawing needles, and adjust the techniques accordingly. Although each part of the cerebral cortex has its own functions, some variation is possible. When one area is impaired, this area can recover to a certain extent or can be compensated somewhat by other areas with proper scalp stimulation. This may be the mechanism by which scalp acupuncture is successful in treating dysphagia. Correct food consistency, texture, and temperature are important for the dysphagia patient success during acupuncture treatment. All 3 factors are important as they act to heighten lingual control, reduce oral muscle fatigue, minimize the patient's fear of choking, and provide a cohesive bolus to stimulate a swallow reflex. A dysphagia diet uses foods that stimulate swallowing and minimize mucus buildup around the larynx. Dysphagia may lead to malnutrition and dehydration, and at the most severe stages can cause choking, aspiration, and airway obstruction. Therefore, it is imperative to deal with the dangers of dysphagia through dietary management once acupuncture has been instituted. Overall, the patient had a very successful recovery, progressing from dysphagia to total normal eating within just a few weeks. This case study followed the patient as his post-stroke swallowing status changed and various acupuncture decisions were made. In addition to scalp acupuncture, the ear and body acupuncture were very helpful in the patient's progress and recovery. This case illustrates that scalp acupuncture could be the primary approach to manage swallowing disorder. Thank you very much for your attention.